So today we're going to be talking about something that's become really increasingly crucial to healthcare, and that is the loneliness epidemic.
Oh, absolutely.
And as healthcare professionals, you guys are on the front lines of this.
Right.
So we have some recent data and research that I think would be really insightful for you all.
Yeah, I think this data is going to be really eye-opening, I think, for a lot of folks out there.
So we're going to be talking about demographics, trends,
Absolutely.
causes all of that.
The why behind it all.
Yeah, the why behind it all, so that you can really understand and better support your patients.
Because as we all know, loneliness, it's not just a feeling.
Yeah.
It really impacts mental well-being.
Yeah,
It impacts physical health treatment outcomes.
Yeah.
The whole picture of patient care.
absolutely.
Yeah.
And so one of the things that just jumped out at me when I was looking at the research was a Gallup poll that found that 20% of U.S. adults
Wow.
are experiencing loneliness every day,
Every day.
every single day.
That's a lot of people.
And that's the highest it's been in the past 2 years.
Yeah, and this really brings to the forefront the Surgeon General's declaration of a loneliness epidemic back in 2023.
Right.
And what's even more striking is this trend was on the rise before the pandemic hit. This isn't just a temporary thing.
It makes you wonder if we were already heading for a crisis and the pandemic just,
Accelerated it.
accelerated it.
Pushed it right over the edge.
Right.
Yeah.
So let's dig into those numbers a bit more.
Okay.
What did you see when you were looking at the demographics of loneliness?
Yeah. So one of the biggest misconceptions is that loneliness, it's an elderly thing.
Right.
That's who it impacts.
Right.
And while that is true to a certain extent,
Right.
it's not the whole picture.
Right.
The data shows us that actually there's this U-shaped pattern where loneliness peaks in young adulthood,
Oh,
like 18 to 22,
oh, wow.
and then it dips a little bit during middle age and then climbs back up later in life.
Okay. So not just grandma and grandpa.
No.
So how did the studies explain that pattern,
Right.
especially that spike in young adulthood?
Right. So think about what's happening during those years. You've got young people leaving home,
Yeah.
navigating new cities, starting careers.
Yeah. So much.
It's a time of immense change and uncertainty.
Yeah.
And it can be very easy to feel lost in that shuffle, even when you're surrounded by people.
Right. It's that paradox
Yeah.
of being surrounded by people and feeling totally alone.
Yeah. And then as we get older, we face, different challenges like retirement,
Right.
health issues, maybe the loss of loved ones. And
Right.
all of these things can really shrink our social circles.
For sure. And it brings up this point that loneliness isn't just about physical isolation. It's about that perceived gap between the social connection we want
Yes.
and what we actually have.
It's subjective. You could be in a bustling office. You could be in a seemingly happy marriage and still be experiencing that deep sense of loneliness.
Yeah, that's such a crucial distinction, I think, for healthcare professionals,
Yeah.
because you can't just assume that someone who appears socially connected
Yeah.
is immune to this.
You got to look a little bit deeper.
Yeah, absolutely.
Yeah.
Understanding those factors that contribute to loneliness, I think, is huge.
Huge. Yeah.
Yeah, it's not just a simple cause and effect. There's a lot of things at play.
Right.
Societal shifts, economic factors, mental and physical health considerations. It's very complex.
A web.
A web.
Let's try to unpack that web a bit.
Okay.
What are some of those societal changes that you think are contributing to this epidemic?
We're seeing a lot of changes to family structures. More people are living alone.
The rise of urbanization, traditional community bonds are weakening in a lot of these urban settings.
Yeah.
And that can lead to a sense of anonymity and isolation.
Right. And I think about technology too.
Oh, yeah.
While it can connect us, in some ways, it can also be
Double-edged sword.
totally. Yeah.
Yeah. Excessive social media use can actually fuel feelings of inadequacy and loneliness, especially when you're comparing your life to these curated online personas. It's not genuine connection.
Right. And then there's the economic piece of it too.
Oh, huge.
That Gallup poll we talked about earlier found that there was a correlation between loneliness and income,
Yeah.
with higher rates of loneliness being in those lower income households.
And that makes sense because economic hardship comes with a cascade of other stressors.
Right.
Job insecurity, housing instability, limited access to resources.
Yeah.
And all of those things can make it harder to prioritize social connection
Right.
or engage in activities that foster those bonds.
Absolutely.
Yeah, it's all interconnected.
And then mental and physical health condition.
Right.
They can both contribute to and be exacerbated by loneliness.
Yeah.
It's a cycle.
A vicious cycle. Yeah.
So things like anxiety, depression, and disabilities
Right.
can make it more challenging for people to connect,
Absolutely.
which leads to further isolation and loneliness.
And then the chronic stress of loneliness can worsen those conditions.
Yeah.
It's complex.
Yeah.
It's a very complex interplay.
It is.
Yeah. Yeah, it's like this tangled knot. And sometimes it's hard to know where to even begin to unravel it.
Right.
But healthcare professionals are often that first point of contact
Yeah.
for patients that are struggling with all of these interconnected issues.
Yeah, for sure. For sure. I guess my question then is,
Yeah.
what are the red flags?
Right.
How can we as healthcare professionals identify a patient who might be experiencing this, even if they don't explicitly say so?
Yeah, that's a great question. And it does require a little bit of detective work.
Right.
But there are some telltale signs. You might notice changes in their demeanor,
Okay.
increased irritability,
Okay.
withdrawal from social activities, or just expressions of hopelessness.
Okay.
They may report feeling fatigued, having trouble sleeping, a lack of motivation.
Okay. So like subtle changes in behavior and mood
Exactly.
could be early indicators.
Yeah.
These symptoms could be associated with other conditions too.
Right.
How do we differentiate loneliness from, say, depression?
That's where a thorough assessment comes in.
Okay.
And while loneliness and depression do often overlap, there are some key distinctions.
Okay.
With depression, the focus is really on low mood and a pervasive sense of sadness.
Okay.
Whereas with loneliness, it's more about that longing for connection, that feeling of emptiness because of the lack of meaningful relationships.
That makes sense. It's about the quality and fulfillment of social interactions versus just the presence or absence of.
Yeah, exactly.
So I think it's challenging in a busy clinical setting. How do we assess this?
Yeah. Are there any tools or like questionnaires that we can use?
Are there tools
Lots
that
of-
make it a little bit more systematic?
Yeah, there are several validated scales that can help you assess for loneliness in your patients.
Okay. Like what?
One that's commonly used is the UCLA Loneliness Scale,
Okay.
and this one measures subjective feelings of loneliness and social isolation.
Okay.
Another option is the de Jong-Gierveld Loneliness Scale.
Oh, wow. That's a mouthful.
It is.
Okay.
But this one assesses both the emotional and social aspects of loneliness.
Okay. So we've identified a patient.
Right.
They're experiencing loneliness.
Okay.
What are the next steps?
So how do we intervene?
Right. How do we effectively intervene?
And that's where we move from assessment to action.
Okay.
And there's no one-size-fits-all approach. Really about tailoring the interventions to the individual patient's needs and circumstances.
Yeah.
But the good news is there is a growing body of research that provides evidence-based strategies
Okay. That's encouraging.
for addressing loneliness.
So give us some concrete examples
Yeah.
of interventions that we can implement
Of course.
in our practice.
So let's start with a simple but powerful one: active listening and validation.
Okay.
Creating that safe space for patients to share their feelings without judgment can be incredibly therapeutic. Sometimes just feeling heard and understood
Yeah.
can make a world of difference.
Yeah. I agree with that. I think we often underestimate the power of just being present
Right.
and attentive to our patients' emotional needs.
Yeah.
So that's a good one. Active listening. What else?
Okay, so let's get a little bit more proactive.
Okay.
One approach is connecting patients with community resources that
Okay.
align with their interests and their needs.
Okay.
This could involve support groups, social clubs, volunteer opportunities, or even faith-based organizations.
Okay. So that, I imagine, requires us to know our community
Yeah, you got to know your community.
a little bit. Are there online databases that can help us with this?
Yes, there are.
Okay, great.
Websites like ARP
Okay.
and the National Coalition for Mental Being,
Okay.
they have directories that list community resources specifically for older adults.
Okay.
And then a lot of local communities have their own websites or hotline where you can find information about social services and support groups for people of all ages.
Perfect. So beyond connecting patients to these existing resources,
Yeah.
are there specific techniques or therapies
Oh, yeah.
that have been shown to be effective in reducing loneliness?
Absolutely. So CBT.
Okay. Yeah. Cognitive behavioral therapy.
Yes.
Makes sense.
This is a well-established therapy for various mental health conditions.
All right.
And it's also been proven to be beneficial in addressing loneliness.
Okay.
So CBT can help individuals identify and challenge negative thought patterns
Okay.
that are contributing to their feelings of isolation.
So, for example, if a patient believes they're unlovable or unworthy of connection,
Right.
CBT can help them reframe those thoughts
Exactly.
and develop more realistic and positive self-perceptions.
Yeah, and it also equips patients with practical skills for building and maintaining relationships,
Right.
like initiating conversations,
Okay.
assertiveness training, conflict resolution.
So these are good skills for anybody,
Absolutely.
not just people experiencing loneliness.
Right. It's about fostering healthy social interactions in general.
Yeah, for sure. Okay, so we got CBT.
Mhm.
Are there other therapies that have shown promise?
Another approach that's gaining traction is mindfulness-based interventions.
Okay.
So things like meditation and yoga,
Right.
they can help individuals cultivate a greater sense of self-awareness, compassion,
Ah.
and connection to the present moment.
Yeah, I can see how mindfulness could help people become more attuned to their own emotions and also more present in their social interactions.
Exactly. You've hit the nail on the head. Mindfulness can also help individuals manage the stress and anxiety
Yeah.
that often comes with loneliness.
Yeah.
So it's creating a more conducive environment for building those healthy relationships.
So we have community resources,
Yeah.
CBT mindfulness interventions, like a whole toolkit.
We've got a toolkit.
But it seems like implementing these interventions requires a shift in our approach to healthcare in general.
It does.
It's more than just treating physical symptoms.
Yeah, it requires a more holistic approach
Right.
that recognizes that interconnectedness of physical, mental, and social well-being.
Yeah.
And this brings us to a crucial point.
Okay.
Addressing loneliness effectively requires a system-wide change.
Okay. Let's talk about that.
Okay.
What needs to happen
Right.
at a systemic level to make this a priority?
For starters, we need to integrate routine loneliness screening into primary care settings.
Okay.
This could be as simple as asking a few simple questions during those routine visits
Okay.
to assess their level of social connection and their risk for loneliness.
Yeah. I can see that requiring training for healthcare providers
Absolutely.
to be comfortable asking those questions and then also knowing what to do with those answers.
We need to equip healthcare professionals with the knowledge and skills to recognize it,
Right.
to conduct these brief assessments, and to refer patients to the appropriate resources.
Okay. And beyond training, what about policy changes
Yes.
that could support this?
We need to advocate for policies that reimburse healthcare providers for their time
Right.
spent addressing social determinants of health, including loneliness,
Right.
because currently the healthcare system is largely focused on treating those physical ailments,
Yeah.
and there's often little incentive for providers to really delve into the social and emotional needs of their patients.
Yeah, that's a good point. If we want healthcare professionals to prioritize this, we need to create a system that values it,
Exactly.
supports that work.
And we also need to advocate for increased funding
Yes.
for research
Right.
on loneliness and the development of effective interventions.
Yeah, the more we understand, the better equipped we'll be.
Absolutely.
So we have individual interventions,
Mhm.
community resources,
Yeah.
system-wide changes.
This multi-pronged approach.
Yeah, for sure.
Yeah.
But let's bring it back to the individual healthcare provider.
Correct.
What can our listeners do
Yeah,
in their daily practice right now?
that's a great question. And there are several things that you can do right now to make a difference.
Okay.
First and foremost, be mindful of your language and your approach.
Okay.
Simply asking patients about their social connections can open up that dialogue
Yeah.
and create a space for them to share their experiences.
So something as simple as, how are things going with your friends and family? Do
Exactly.
you feel like you have enough support?
Yeah. Those questions may seem basic,
Right.
but they can plant a seed and signal to patients that you care about their overall well-being,
Right.
not just their physical symptoms.
Absolutely.
Yeah.
And what about incorporating social connection into treatment plans?
Yeah.
How can we weave that in?
That's where the creativity comes in.
Okay.
If you're recommending exercise, for example, encourage your patients to find a walking buddy
Okay.
or to join a group fitness class.
Yeah.
If they're struggling with stress, suggest exploring mindfulness groups or community yoga classes.
Yeah, so it's just about finding those little opportunities
Yeah, those little nudges.
to nudge them towards that social engagement.
Exactly. And remember, even small gestures can have a big impact.
Yeah.
A warm smile, a genuine expression of empathy, a willingness to listen.
Right.
These seemingly small acts can go a long way in creating a connection with your patients.
Right.
And making them feel seen and heard.
I love that those are good reminders.
Yeah.
It's about shifting our mindset
Yeah.
and recognizing that addressing loneliness is not just
Right.
an extra task on our to-do list.
No, it's part of holistic care.
Right. Exactly.
It's an integral part of providing compassionate and holistic care.
Beautifully said. And I think also it's important to remember that we don't have to have all the answers.
You don't have to have all the answers.
We don't have to solve every problem.
Sometimes simply acknowledging the impact of loneliness and connecting those patients with the right resources
Yeah.
is enough to spark a positive change.
I like that it's about empowering patients to take ownership of their own social well-being,
Yes.
and then providing them with the tools and support that they need to thrive.
Exactly.
Yeah.
And remember, healthcare professionals, we're not immune to loneliness either.
That's a good point.
It's crucial to cultivate those self-care practices
Right.
that nurture our own social connections and well-being. We can't pour from an empty cup.
That's a good point. Taking care of ourselves enables us to better care for our patients.
Exactly. Yeah, it's so important.
This has been such an eye-opening conversation.
It really has.
So as we wrap up our deep dive,
Yeah.
I'm curious,
Yeah.
what's the one key takeaway you want our listeners to remember?
Oh, that's a good one. I think it really comes back to shifting our perspective.
Okay.
Instead of viewing loneliness as the separate issue,
Yeah.
let's start seeing it as a vital sign,
Oh,
just as important as blood pressure or heart rate.
wow.
You know, it's a signal that something needs attention.
Right.
And it's our responsibility as healthcare providers to listen and respond.
I love that analogy.
Yeah.
It really elevates the importance of it. And
Yeah.
if we can normalize talking about it,
Yes.
we can reduce that stigma
Absolutely.
and empower our patients to seek help.
Yes. And remember, you don't have to be a therapist to make a difference.
Right.
Small changes in how we approach patient care can really have that ripple effect.
Yeah.
Even just asking about social connection
Right.
can create that sense of openness and trust.
I love that. For those who are ready to take the next step,
Yeah.
what resources would you recommend?
There's a wealth of information out there. We'll be sure to include links in the show notes to resources like the Surgeon General's Advisory on Loneliness,
Okay.
the UCLA Loneliness Scale,
Yeah.
and those directories of community resources that we talked about.
Perfect.
You'll also find links to organizations like the Foundation for Social Connection
Okay.
and the Campaign to End Loneliness,
Right.
which offer evidence-based strategies and toolkits specifically for healthcare providers.
Awesome. So many great resources.
Yeah,
As we wrap up this deep dive, I'm feeling hopeful.
me too.
It's clear that this is a challenge, but
Yeah.
not insurmountable.
Not at all.
And I think with increased awareness, compassionate care, collaborative efforts,
Yeah,
we can really make a difference
we
for our
can.
patients and ourselves.
I completely agree. It's time to recognize social connection as the fundamental human need that it is
Yeah.
and really integrate it into the fabric of our healthcare system.
I love that.
And by working together, we can create a future where loneliness is no longer an epidemic, but an opportunity for growth and healing.
That's beautiful to all our listeners. Thank you so much for joining us on this deep dive.
Thanks, everyone.
We hope this episode has sparked some new ideas and inspired you to take action.
Yeah, get out there.
Remember, even small steps can make a big difference.
Absolutely.
Just by starting a conversation, listening with empathy,
Yeah.
and connecting patients with the right resources, you can have a profound impact
You really can.
on their well-being.
Yes.
Let's work together to build a more connected and compassionate world, one patient at a time.
One patient at a time.